Now in this video we will discuss about the management of delivery and note for postpartum care in patients with maternal bleeding risk. Now if you can see, the management for the high risk and medium risk sections is the same. So they are the categories which we have to be concerned about. So the high risk and the medium risk patients are the ones that we will have to discuss in detail, because the mild risk patients, this category only requires tranexamic acid for delivery and postpartum. So we have to just give tranexamic acid in this category of patient, and that is going to serve the purpose. For patients who are unlikely to be at risk, we do not need to give anything. There is no restriction per se for this category of patient. Now, to understand the management of the high risk and the medium risk category, the easiest mnemonic to remember this management is this plastic water tank. Now we all know that for this tank to be functional and to deliver water, it is very essential to maintain the minimal levels of water inside the tank. So if you want this tank to be functional, the water has to be adequately replaced. And if water is not adequately replaced, or if there is a leak made in the system, if you are puncturing the plastic container, then definitely this plastic water tank will not serve its function. Similarly, in the high and the medium risk category, if the patient is bleeding, it is very essential to maintain the normal levels of the factor when the patient is in established labor. Okay, so you have to add water. That is, you have to, what is the water in this tank? It is the factor. So factor replacement, adequate replacement of the factor is very essential when the patient is in labor. Otherwise she will bleed and it will be extremely difficult to manage in an emergency condition. We don't want the patient to land up in a bad situation. So for the high risk and the medium risk patients, just remember this tank, and when the patient is in need, that is when she is in established labor, just ensure that adequate replacement of water in this tank, that is the factors in the body, is being done. And you should not puncture the body. You should not puncture the tank. That is, you have to avoid using central neuraxial anesthesia until and unless the water that you've given is adequate for replacement therapy. So once you have to ensure adequate replacement of the deficient factor is done, till then don't puncture the water tank, otherwise the whole system will not function. And one more thing is important, you have to monitor the patient and ensure that for 3 days postpartum and 5 days following C-section, the normal levels of the factor is being maintained. And this is very easy to remember. If you remember the face of this panda, the 2 eyes are the 2P, that is postpartum, and the mouth is like the number 3. So postpartum, the maintenance, the normal factor maintenance has to be there for 3 days. And for C-section, section looks like 5. So for 5 days, we have to, that normal levels of the factor is being maintained following C-section. So the mainstay criteria for the management of these patients is replacement of the water in the tank, that is coagulation factor which is deficient, its replacement in the body, and don't puncture the tank, that is don't let out the water in the tank, that is do not give central neuraxial anesthesia till you have ensured that adequate replacement therapy has been confirmed, and this maintenance of normal levels has to be maintained for 3 days postpartum. Remember this panda? 5 days for C section, because section looks like 5. So, very, very easy to remember. The management, remember the tank, don't puncture it. Very, very easy. And for the other categories, we know that the unlikely category, there is unlikely management, nothing much needs to be done. And for the mild risk, we have to only give tranexamic acid during delivery and postpartum. And one more thing we have to remember is all this that we're talking about is from established labor. When the patient is in established labor, we have to ensure that adequate replacement therapy has been given to the patient at the onset of established labor. And definitely neuraxial anesthesia, when we're talking about it, it also encompasses the C-section patients. So very, very easy to understand the management of delivery and postpartum care. Thank you.